The People's Healthcare Act introduced by the province earlier this week is long, vague, and promises to put an end to hallway healthcare, largely by amalgamating 20 healthcare agencies into one super agency. But some of the agencies the government plans to merge services millions of people have become the gold standards of care, namely the Trillium Gift of Life Network, which coordinates organ donation and transplantation. Also, Cancer Care Ontario, the government's principal cancer advisor.
Those two agencies are, I would say, the envy of the world. Our organ donation, Trillium Gift of Life, is very successful, been very effective, and is a great organization. Cancer Care in Ontario, exactly the same thing. Right? It's kind of the envy of the world. We have an excellent cancer system. Our outcomes are very good. There's constant improvement. The concerns are valid.
I don't think it bodes well for folks that are waiting for services or that have been receiving services or going to be needing services, whether that's through Cancer Care Ontario or whether that's the Trillium Gift of Life Network. I'm very, very concerned, and I'm not hearing from the government any assurances that those services are still going to be available, or that, for example, with the Trillium Gift of Life Network, that people who are waiting for organ transplants are not going to be disrupted through this process and have their procedures and their transplants postponed or taking longer on the waiting list than necessary.
But Health Minister Cristina Howorun says the super agency and the 30 to 50 Ontario healthcare groups that will be created through the Act will be tailored to deal with very specific populations.
Doing the work, for example, that Trillium does, something that spans across the province and the country. You're asking a small little organization to handle such a big file.
Well, most of the local Ontario health teams will be based upon geography. We are anticipating 30 to 50 of them at maturity. They will be responsible for populations of up to about 300,000 people, but there will also be some Ontario health teams that are going to focus on specific areas provincially. Transplant patients, for example, children with medically complex needs.
Cancer Care Ontario would not provide a comment on the potential impact the bill will have on cancer treatment in the province. But Dr. Jeffrey Zaltzman, the Chief Medical Officer of Transplant at Trillium, says there's nothing in the bill that he thinks should give patients concern.
Trillium has always, since its creation, has always tried to implement best practices with respect to organ and tissue donation and transplantation, and I don't see that changing in any way in the future, regardless of what part of the health system Trillium is embedded in.
Still, Zaltzman acknowledges there are potential redundancies that could result in job losses, although the details of the government plan aren't clear yet. The bill passed first reading yesterday and is expected to be debated in coming weeks.